So good day to all of you. I am Nicole D. Nagar from Davao Doctors College, PSN 212K. And for today's video, I'll be doing female urinary catheterization. Female urinary catheterization is a insertion of a catheter through the urethra into the urinary bladder for withdrawal of urine. Straight catheters are used for intermittent withdrawals, while indwelling catheters are inserted and retained in the bladder for continuous drainage of urine into a closed system. So before anything else, let's proceed to the video. First step is to check the doctor's order for catheterization for us to know if it is the right patient. Next is to wash hands before preparing the set and identify the patient and of course explain the procedure. Next is I already prepared the necessary equipments that I'll be using for this assessment, including sterile gloves, betadine, lubricating gel, cotton balls, injection, and sterile water. So good day, ma'am. I am Nicole D. Nagar, your student nurse from Davao Doctors College. And for today, I'll be doing catheterization. But first things first, I would like to ask if what is your full name and may I see your wristband, please? Okay, please state your birthday and your age. Okay, ma'am, so I'm going to perform catheterization, which means I'm going to expose your private area. Is that okay with you? Okay, ma'am, since you cannot control your urine and empty your bladder, the doctor advised to put catheter. Is that okay? Okay. So next is to provide privacy to the patient by closing the door and of course closing the curtains, and position the patient in the dorsal recumbent with the knees flexed. So ma'am, I will just provide privacy for you by closing the door and by locking the door and of course closing the curtains for you to feel comfortable. Would that be alright? Okay, so ma'am, next is can you position in the dorsal position recumbent with the knees and knees flex? Okay, so next is drape the patient, exposing the area only. Okay, so ma'am, I'll just expose your private area. Next is to apply light into the genital area. So I already apply light into the genital area. And open the tray and arrange the equipments for convenience and according to avoid contamination of sterile items. So open the set observing the sterile technique. Put the sterile gloves. Next is to lubricate the catheter into 1.5 inch. Careful not to plug the eye of the catheter. So using the sterile forceps, clean the area using cotton balls with betadine. So just cleanse the labia area and make sure do not rub against the cotton balls. Only one stroke. So dispose the unsterile cotton balls properly. Next is to lubricate the catheter 1.5 inch. Make sure to not careful to plug the eye of the catheter. Pick up the catheter at least 3 inches from the tip of the thumb. Place the thumb and one finger of the left right hand between the labia minora and separate and pull up gently. So insert the catheter into the meatus for 2 to 3 inches until the urine begins to flow. If the specimen is to be collected, pinch the catheter with the thumb and the finger while placing the specimen in the container of the physician. Rest the hand and pubis area while holding the catheter in place to prevent pulling and pushing of the catheter. Next is to connect the catheter into the urine bag. Inflate the balloon into 10 to 15 cc for sterile water using a 15 to 20 cc of syringe. Okay, secure the end-rolling catheter by taping the patient's thigh, so allow some slants of tubing to accommodate the patient's movement. Tape the catheter into the patient's thigh, so place the patient comfortably. So next is do the aftercare and secure the time of procedure done and amount of color of initial output. So that will be all. Thank you.